My presentation will be on the disparities of health in veterans. For my community engagement activity, I attended a Veterans Memorial Service at Antioch Community High School. The population of veterans who put themselves in a position of harm to protect our country unfortunately have many health disparities as a direct result of their service in the United States military. The definition of health disparities by the Center for Disease Control is the following. Health disparities are preventable differences in the burden of disease, injury, violence, or opportunities to achieve optimal health that are experienced by socially disadvantaged populations. My issue with this definition is when related to veterans is the use of the word preventable. War is traumatic, and it's impossible to prevent an increased number of injuries and diseases in this population of such high risk. However, we can and must provide as much support and health services as we can for the men and women who have sacrificed their bodies and their minds for us. Currently, about 0.5% of the American population actively serves in the military. However, approximately 7% of the population in the United States have served in the military at some point. This is a huge at-risk group equaling almost 23 million people. There are many health disparities in this group, but I will be highlighting just a few. The first I'll be looking at is traumatic brain injury, or TBI as I'll be referring to it. This is often caused by a blow to the head or an explosion in close proximity to an individual, such as would occur during an explosion of a roadside bomb or a suicide bomber, as was seen particularly in Iraq and Afghanistan. The highest risk group for TBIs is between 18 and 24-year-old men. TBIs can lead to shorter attention spans, language disabilities, and an inability to process information, as well as a lack of motivation, irritability, anxiety, depression, and memory loss. There is a link between PTSD and TBI, with about 7% of veterans experiencing both post-traumatic stress disorder and traumatic brain injury. Speaking of PTSD, there is another ailment that disproportionately affects veterans. It's challenging to acquire accurate statistics regarding the rate at which post-traumatic stress disorders affect veterans, especially considering only about 50% of veterans even seek any treatment for their PTSD. The rate also fluctuates among wars, with the Vietnam War having the most prevalence of PTSD, with about 30 of every 100, or 30%, of Vietnam vets having experienced PTSD in some point in their life. Among the recognized cases of PTSD, the Army contains the most people suffering, with 67% of known cases. There are 4 main types of PTSD symptoms, including reliving the event, avoiding situations that remind you of the event, negative changes in beliefs and feelings, and being in a continuous state of hyperarousal. All of these main symptoms have extensive subgroups of symptoms as well. The last health concern I'll be touching on is a very disturbing disparity in the suicide rates among the veteran population. Veterans have a 21% higher rate of suicide than the civilian population, and in 2014, veterans accounted for 18% of deaths by suicide. The reason for such high rates of suicide among veterans cannot be definitively proven, but strong evidence shows that the highest rates of suicide are among those who experience combat trauma and injuries multiple times, and or been hospitalized because of wounds they received in war. Another study also demonstrated that veterans with PTSD have higher rates of suicidal attempts, even after controlling for other factors such as disease or mental disorders. Those who have risked their lives, sacrificed time with their families, as well as mental and physical health for the protection of our country, should be provided the services needed to aid in recovering from the trauma they have experienced. This should be This should include being connected to a group of veterans who experience similar trauma and being encouraged to talk to each other about their symptoms and experiences. This would hopefully develop a support system of people who know what it's like to go through what they've been through, and hopefully help the veterans feel less isolated and connected to a group of people. In addition, access to counselors and psychiatrists who have specialized in cognitive behavioral therapy should be provided and encouraged. This type of therapy is especially helpful for veterans suffering from PTSD. Also, education about the symptoms of PTSD and suicidal tendencies for families of soldiers and veterans should be provided. Families of veterans need an explanation as to why their loved one is acting differently, agitated, or even sensitive, and how they may help. Thank you for watching.